guys. Inshallah, today we'll be talking about osteoporosis. As for osteoporosis, it's one of the more important diseases that you will be taking this semester. Okay. To understand now osteoporosis, simply you need to know the bone physiology. You need to know the bone function. Why? Because simply when function goes wrong, then this will lead to pathology. This will lead to a disease. So if you understand the normal function, you can simply understand how it can go wrong, and finally you can understand how this disease has come to be. Okay. Now, to understand the bone, or actually to the bone physiology that you need to know about osteoporosis is the osteoclasts and the osteoblasts. Okay. Osteoclasts, they help in breakdown, and osteoblasts, they help in formation. Okay. For osteoporosis to occur, okay, you need to have more breakdown than there is formation. That means we need to have more osteoclasts acting on the bone than osteoblasts, sorry, like that. Okay. So if there's more osteoclasts and there's less osteoblasts, then this could predispose us to osteoporosis. So let's talk about what stimulates osteoclasts and what stimulates osteoblasts. Osteoclasts are stimulated by rank L, glucocorticoids, and PTH, while osteoblasts are stimulated by estrogen, calcitriol, calcitonin, and growth hormone. Okay. As well as that, we need to know that osteoclasts are inhibited by OPG, which is known as osteoprotegrin, okay, IL-10, and TGF-beta. Okay, these are the different things that act on the bone that allows it to either have more formation or more breakdown. Of course, breakdown and formation is important for the bone. If you have more of one than the other, that means you have lost the homeostasis that keeps the bone as it is. So for osteoporosis, we said the loss of homeostasis is simply when we have more breakdown than formation. So we have more osteoclasts than osteoblasts. And most importantly, we need to focus on is the rank L, OPG, and estrogen. These three things that we talked about that help stimulate, inhibit osteoblasts and osteoclasts are going to play a major role on how osteoporosis occurs. Okay. Now, as we go down, we're going to talk about now the risk factors, first of all. For the risk factors in your lecture, there is the mnemonic axis. It's easy and simple. If you go over it, immediately you're going to memorize the risk factors for osteoporosis, okay? But what I want to get here simply is I want to make you understand the reason behind these different risk factors. Age, for example. Age, as we know, when a person is younger, okay, he has more bone formation because he's growing, okay? As he grows older, the bone formation decreases. You don't need formation of bone no more because khalas, you've grown up, okay? Therefore, the breakdown is going to take over and therefore osteoporosis occurs. Again, vitamin D deficiency. Vitamin D is always associated with what? With calcium, okay? It's also always associated with PTH. So this can also explain PTH. So vitamin D, PTH, calcium can all play a role in predisposing to osteoporosis, but not just that. It can also predispose us to other bone diseases that we will talk about later. Okay? Estrogen deficiency, and this is going to be the most important one. Why? Because we're going to talk about it in a bit, but postmenopausal women they have the highest risk factor when it comes to getting osteoporosis. Okay, so to get osteoporosis, okay, postmenopausal women, okay, have the highest risk factor when it comes to that. Okay, that's why. So postmenopausal women have the highest risk factors when it has to do with osteoporosis. That's because they have a lack of estrogen in their bodies, okay? And we're going to talk about the exact mechanism why a deficiency in estrogen causes osteoporosis, okay? Finally, we have smoking. Of course, smoking causes a lot of problems due to the different amount of chemicals it occurs, and you're going to see later on as you study throughout the medical year, smoking is a huge risk factor to a lot of cancers, diseases, all across the body, okay? Now, how does estrogen even work on the bone, okay? Like, what does estrogen do to the bone that causes it to be a major player when it comes to osteoporosis? Simply what you need to know, guys, is estrogen, as we said above here, it stimulates osteoblasts. Okay? But it also does something else. It stimulates OPG. And what was OPG when we talked about it here? OPG inhibits osteoclasts. But how does it inhibit osteoclasts? By inhibiting rank L. And what was rank L again? It was the molecule that stimulates osteoclasts. So again, estrogen, it promotes osteoblasts function, and it also promotes the formation of OPG. OPG inhibits rank L and decreases the amount of rank L in our body, which actually rank L is simply a promoter of osteoclasts. So if you inhibit rank L, you're indirectly inhibiting osteoclasts. So an increase in OPG means there's going to be a decrease in rank L and a decrease in osteoclasts. Okay? So what if estrogen decreases? And this is what we see in postmenopausal women. First of all, there will be a decrease in osteoblast activity. Therefore, there will be decreased formation. That's one problem occurring. Less formation. Two, there will be less OPG. Therefore, there will be more rank L, and therefore, there will be more osteoclasts. And what will this cause? It will cause more breakdown. Boom. More breakdown. You get it? بالضبط. خلاص. We just okay. But so less formation due to the fact that there is less osteoblasts, more breakdown due to the fact that there's more osteoclasts functioning, and that causes us to be predisposed to osteoporosis. So postmenopausal women has a clear problem when it comes to osteoporosis due to this physiology that we find in the human body. Okay? So simply, when we have a disease, we need to understand how to diagnose it. Like seriously, like we study all this pathology, but in the end, when it comes to the real world, how do we actually diagnose it? Or for the exam's sake, when you get a question, okay, the question tells you كذا 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 كذا, how do you know? No, this question is talking about osteoporosis. Okay, there's a couple of things. The main factor is fragility fracture. What does this mean? This means that the case or the scenario will be simply a fracture that usually does not fracture a person. So what do I mean by here? يعني, let's say you've slipped. Okay, a person normally they slip a lot. Everyone just slips. Wee, boom. I slipped. Bah, I fell on my head. I fell on my hip. Who matters? Okay. Usually, if it's not a really strong like fall, okay, it wouldn't fracture you, right? Like it's just a slip. Everyone slips all the time. But for people with osteoporosis, they actually get fractures from such common slips. Like they slip and they just get a fracture. So this is a huge hint to osteoporosis. What's another big hint? Postmenopausal women, as we always said, postmenopause. Okay? So if a case comes in, it tells you, let's say the case tells you, woman that is above like 60 years old, she slipped and there was a fracture. What will be the first thing you think about? What will be the first thing that's on your differential? Osteoporosis. So a woman above 60 years old, she slipped and there was a fracture, osteoporosis. هيك على السريع بضمانتي أنا osteoporosis. Okay? What else? Dexter T-Score. Now, Dexter T-Score, this is صراحة something that you shouldn't go into details, but simply when there's a value less than negative 2.5 on a Dexter T-Score, then that is also diagnostic of osteoporosis. Finally, the lab values. So this is kind of important because this connects us to the other diseases we'll be talking about later on. And why is this important? Okay, you see, the lab values when it comes to a fracture or a bone disease, we always talk about calcium, we always talk about phosphate, ALP, and PTH. ALP simply, we're going to talk about it in another separate recording, but it's very important when it comes to bone diseases, which is called, ALP is alkaline phosphatase. We're going to talk more about it in another separate video. What I want you guys to understand, calcium, phosphate, PTH, parathyroid hormone, they're all hormones or they're all minerals that work in bone formation and breakdown. They're related to the bone. As a doctor, of course, when you want to like go on and see a typical or a problem in a disease, you want to make sure the calcium, phosphate, PTH could give you a hint to what the disease is. In osteoporosis, as we said, we said the problem is in breakdown and formation because of osteoclasts and osteoblasts. صح ولا لا? So this has nothing to do with the person's diet, whether he takes in calcium ولا لا. It doesn't have to do whether he has a tumor in the PTH or in the parathyroid gland that causes him to produce a lot of PTH. Therefore, it causes a lot of breakdown. لا, it's all on the osteoblasts and osteoclasts. But therefore, usually you will find normal calcium, phosphate, ALP, and PTH values. Okay? Why is this important for other diseases? Because in other diseases, we will see these values differ. Okay? Like, for example, in hyperparathyroidism, we're going to see high PTH. We're going to see high calcium. In Paget's disease, we're going to see high ALP. So these differences, okay, in these bone diseases can make us differentiate between them. So, how to diagnose? Fragility fracture is maybe the most common question part of the whole question. They always question you about it, and they tell you, and someone they just slipped or they just fell on their hip, a common or like a very soft trauma to their bones, and they eventually got a fracture because of it. They will also most probably mention, it's a woman that's above 60 years old, and this all surrounds what the topic osteoporosis. But this is the first disease that you need to understand. We talked about the physiology, we talked about the risk factors and how the risk factors causes osteoporosis or like they predispose to osteoporosis, how the different mechanism of estrogen causes command osteoporosis in postmenopausal women, okay? And finally, how do we diagnose it and how would you tackle a question that comes in the exam or later on in the future as you become a future physician, how you would understand that this person that's in front of you has osteoporosis. And thank you so much for listening, guys. Hope it helped you. If you have any question, of course, drop it down in the comments.